Welcome back, everyone. Today, we're going to be taking a deep dive into how to decode those infant cries.
Yeah.
Which I think we can all agree is a pretty important topic for anyone in healthcare.
Definitely.
So to start off, have you ever encountered an infant patient just inconsolably crying and you just can't figure out what's wrong?
Oh, all the time. It's like one of the most common things we see.
It's definitely one of those things that can really keep you up at night, you know?
Yeah.
Especially when you're worried that it might be something serious.
Absolutely. And that's why we're talking about this today, right?
Okay.
We want to make sure that all our listeners out there have the tools they need to quickly and accurately assess the cause of excessive crying in infants.
Yeah, and that's where the IT-CRIES mnemonic comes in super handy.
Love the IT-CRIES mnemonic.
It's such a good tool.
So helpful.
Because it helps you kind of like go through this mental checklist and really avoid misdiagnosing some serious medical conditions as colic.
Right, because colic is a common diagnosis, like we all know that. But it should only be considered after we've ruled out all those other potential causes of crying.
For sure.
So let's jump right into it.
Yeah, let's break it down.
What does that I stand for?
The I stands for infections.
Infections.
And, you know, infections can be really sneaky in infants especially.
Oh, yeah.
You know, because you might think that something like a urinary tract infection, meningitis, or even sepsis would have some like more clear-cut symptoms.
You would think so, right?
But a lot of times it just presents as fussiness.
Exactly. And that's why, you know, it's so important to have this mnemonic in mind, because it reminds you to consider those possibilities even when it seems like there might not be anything else going on.
Totally.
You know, I've actually seen cases where a baby's persistent crying was like the only red flag for a really serious infection.
Oh, wow.
So it's just a reminder that we can't afford to dismiss any symptom in these little ones.
Especially in infants.
Especially in infants, because they can't tell us what's wrong.
Right. They can't be like, oh, I have a stomach ache or, you know, whatever.
Exactly. We have to be really good detectives.
Okay, so moving on to T.
Okay, T.
Trauma.
Trauma. Okay.
And when we're talking about trauma, it's not just about checking for those accidental injuries like fractures.
Right.
Although those are obviously super important.
Very important.
We also need to be thinking about the possibility of non-accidental trauma.
Right, which is a very sensitive topic, but unfortunately something that we have to consider.
Yeah, for sure.
So when we're thinking about trauma, a comprehensive history,
Yes.
a very thorough physical examination, and just a really keen eye for any subtle signs of injury.
Oh, sure.
All those things are paramount in these situations because sometimes it could be the tiniest little bruise or a slight change in the baby's behavior that gives us a clue that something more serious might be going on.
Exactly. So
C,
cardiac disease.
cardiac disease.
Now, this one I think can throw some people off because we don't always associate heart problems with infants.
Right.
But certain conditions like supraventricular tachycardia, you know, where the heart beats super fast, or myocarditis, which is inflammation of the heart muscle.
Yes.
These can actually manifest as excessive crying or even difficulty feeding.
Yeah, because think about it. If their heart isn't working properly, they might not be getting enough oxygen.
Right.
And that can lead to all sorts of problems, including fussiness and difficulty feeding.
So what kind of things would you be looking for?
If a baby is struggling to feed, seems unusually fussy, especially if there's also rapid breathing or poor weight gain, those are all red flags that we need to consider the possibility of a cardiac issue.
Gotcha.
So
our reactions to medications.
Oh, yeah.
And this isn't just about like looking for obvious side effects from prescriptions.
Right.
It's also about considering things like reflux or even a rectal fissure.
Yeah, those can be really painful. Yeah.
And it's easy to overlook them.
Exactly, because they're not always the first thing that comes to mind.
Right, and yet they can cause so much discomfort for these little babies.
Leading to that excessive crying that we might mistake for something else entirely.
Exactly.
Okay, second I.
Second I.
This one's a big one, intussusception.
Oh, this is a scary one.
Okay, we gotta act fast.
This is a surgical emergency.
It is.
So we need to be on top of this one.
Explain it.
Intussusception is a condition where part of the intestine basically folds in on itself.
Oh, wow.
And it causes a blockage.
Like a telescope.
Yeah, like a telescope, exactly.
Okay.
And it can become life-threatening really quickly if it's not addressed.
Oh, gosh.
So the classic sign, the hallmark sign of intussusception is this intermittent, intense abdominal pain.
Okay.
And that often manifests as these like episodes of inconsolable crying. You know, the baby just can't be soothed no matter what you do.
Yeah.
So we need to be able to recognize that pattern.
And act quickly to get the baby the surgery they need.
All right, so moving on to E.
What is it?
Eyes.
Eyes, easy to forget about.
So easy to forget about.
So important.
It's amazing how something as simple as a corneal abrasion or a foreign body in the eye or even glaucoma can cause so much pain and lead to all that crying.
And you know what's crazy?
What?
Sometimes a thorough eye exam is all it takes to figure out what's wrong.
It can be that simple.
It can be that simple.
Wow.
We often get so focused on like the really complex possibilities that we forget to check the simple things.
Yeah, just look and see.
Just look and see.
Amazing.
All right, last one.
S. Strangulation or surgical processes.
Okay, so this can include things like
hernias,
testicular torsion,
ovarian torsion.
All these require immediate medical attention because they can be incredibly painful. And if they're not treated, they can have really serious consequences.
So the key here is to just have a high index of suspicion.
Absolutely, especially when you're dealing with a crying infant who just doesn't seem to be responding to those typical soothing methods.
So there we have it.
CRIES.
CRIES, a powerful tool for any healthcare provider who's dealing with a fussy baby.
Yeah.
It really helps you to consider a wide range of potential causes and make sure that you're not missing those critical diagnoses.
Absolutely.
That need quick attention.
So remember, CRIES.
CRIES.
But even with the best tools in the world, clinical judgment is still paramount.
Yeah.
You know, something feels off.
Trust your gut.
Trust your gut. Dig deeper.
Ask more questions.
Ask more questions. Don't hesitate to consult with colleagues, specialists.
For sure.
It's all about being thorough and advocating for the well-being of these tiny little patients.
That's what it's all about.
That's what it's all about.
Thanks so much for joining us today.
It's been a pleasure.
We'll see you next time.
See you later.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.